Okay, well, welcome to the Hubert Holmes webinar series. Today we have Piper Christensen, who is a senior consultant at Blue Ridge Management Solutions. She definitely does a lot of help in the areas of CalAIM, uh, program management, credentialing and contracting, and we actually use her and she's wonderful. So if you need any of those services, please reach out to her. Just a couple of housekeeping things that I wanted to add. We encourage questions throughout the presentation. So if you do have questions, just raise your hand, and then I will I will change this to allow you to talk, and then we can get all your questions answered. All right, Hyper, sorry.
Per- Perfect. All right. Thank you so much for that introduction. Let me share the slides that I have. All right. Can you see my screen okay?
Yep, we can see.
Perfect. All right. Well, hi, everyone. Welcome. I'm Piper. I do work for a consulting group called Blue Ridge Management Solutions. We do specialize in helping organizations like Hubert Homes provide CalAIM services, which are important and free Medi-Cal benefits that include things like housing and food assistance, among a variety of other great services that we're going to go over today. So the goal of this webinar is that hopefully you all will walk away with knowledge of extra Medi-Cal benefits that you might qualify for and that you know who to ask about them. Perfect. So before I jump in, I just have a quick few notes. Uh, First, this is just general information. It's not meant to be legal or medical advice. Second, we will have about 15 minutes. I do think we might have a little bit more than that left at the end for any questions that you may have during this presentation. But like Ben said, feel free to ask questions throughout the presentation as well. We won't be able to answer any personal case details in front of everyone, but we can absolutely give you next steps. And last, during this presentation, if you need to take a call, care for kids, anything else, that's totally fine. Come back when you can. We don't want to make you feel like you're stuck here. All right. So this is what we're going to cover today. We're going to start with a quick explanation of what CalAIM is, what Enhanced Care Management, or ECM is, and what community supports are. We'll also discuss a key benefit a lot of Medi-Cal members don't use, which is non-emergency medical transportation, or NEMT, and non-medical transportation, or NMT, that can help you get to medically necessary appointments. Most importantly, we're also going to cover how to ask for these services from your Medi-Cal plan, or your doctor or case manager. Okay. So what is CalAIM? CalAIM stands for California Advancing and Innovating Medi-Cal. And I know that just seems like a really long phrase, but the idea is pretty simple. Think of it as basically Medi-Cal 2.0. Instead of only paying for doctor visits or hospital stays, California wants Medi-Cal to look at like your whole life. So that means recognizing that housing, food, mental health, substance use, and daily support all have significant effects on your health. So honestly, just think of this as like preventative services. CalAIM also involves two important pieces that I touched on previously. It's the enhanced care management part, and they also have 15 community supports. The whole goal is to improve the quality of care and health outcomes of Medi-Cal members by addressing not only medical needs, but also social factors that also have a big impact on health. Under CalAIM, your Medi-Cal managed care plan, which, whether that be Anthem or Kaiser, Alameda Alliance, they now offer extra services that support your life, not just your medical appointments. And so those extra services are what we're mainly going to be focusing on today. Okay, so let's start with Enhanced Care Management, or ECM. Think of ECM as getting a whole care team whose job it is to help support your health by addressing your medical and non-medical needs. What makes ECM special is that it's offered mainly through in-person interaction. Um, wherever you are, whether that be at your home, in a shelter, a clinic, or simply by phone. Members who are eligible for ECM are assigned a lead care manager that work to meet you wherever you are and like not the other way around. You shouldn't be having to find them. ECM is usually for people with more complicated situations like serious mental health needs, substance use, being unhoused or at risk of being homeless, going in and out of the hospital a lot, maybe coming out of jail or prison. There are seven um, like core components to enhanced care management under CalAIM, and those include outreach and engagement, comprehensive assessment and care management plan, enhanced coordination of care, health promotion, comprehensive transitional care, member and family supports, and referral to community and social services. And I know that just it sounds like a lot of words, but basically that means that your ECM team can help you keep track of your appointments and reminders, help you fill out forms and applications or appeals, connect you to dental care, mental health, substance use treatment, and other super helpful programs. It can also help support you with things like housing, food, transportation, and other needs that all have an effect on your health. So ECM is meant to give you a real team, instead of just leaving you feeling like you're your own caseworker, case manager, which, can be super overwhelming and is not helpful. So you might be wondering, is ECM for me? You might be eligible if you don't have stable housing. So this includes maybe you're living on the street, couch surfing, staying in shelters, or being at serious risk of losing your housing. If you have serious mental health needs or substance use challenges, if you go to the emergency room or hospital a lot, if you're just coming out of jail or prison or another institutional setting, and are trying to re-enter the community. You might be eligible if you have multiple health conditions, and need help coordinating care and staying on top of everything. Children and youth, including those in foster care, those with intellectual or developmental disabilities, and pregnant or postpartum individuals may also be eligible for ECM. The Department of Healthcare Services released like specific populations of focus is what they're called. So that's mainly what they're looking at, and then each one has eligibility criteria. So your Medi-Cal managed care plan does make the final decision if you're eligible or not. But you absolutely can and should ask to be evaluated for ECM if you feel like you would benefit from this service. Okay. Now let's talk about community supports. Community supports are extra services that Medi-Cal managed care plans can choose to offer their members. The goal of these supports is to keep you stable, help you avoid the hospital, and support you in the community instead of in institutions. Right now, there are 15 community supports that are available in California. These extra supports are meant to address general health-related, social, and environmental needs. And it's important to note that not every care plan offers every support in every county. But the good news is that I do know that many of these are available right now in your area. Okay. So as we might know, for many people, housing is one of the biggest barriers to stability and health. This is why the community support called Housing Transition Navigation Services, you might also see it as HTNS, is absolutely a great resource. If you are eligible for this support, it means that someone helps you search for housing, fill out applications, gather documents like IDs, proof of income, disability paperwork, like anything that you need to secure housing. This service also helps you communicate with landlords or property managers, and like, so many other helpful items as you work to secure that housing. And unfortunately, this support doesn't guarantee a unit, but it definitely makes it much easier to move through the housing process, which can be super complicated. Okay. So once you are able to secure a place, the next big barrier is usually upfront costs, and being able to stay housed. Housing deposits can provide one-time financial help for essential move-in costs. So these one-time costs may include security deposits, utility setup fees. If you do owe like utility fees from a different place you were living in, sometimes it can also cover like that quote unquote debt. Um, and it may also cover like cleaning or repair fees and other essential move-in costs. And this support you're generally only approved one time, but you can definitely ask your managed care plan, like maybe your situation changes, you move and you need it again, because sometimes you can be approved a second time for this support. And another helpful support to long-term housing security is housing tenancy and sustaining services. You might also see this as HTSS. Um, and this really focuses on helping you stay housed once a unit is secured, because it assists with items like understanding and following your lease, working through landlord conflicts that may come up, um, keeping up, with your rent and utilities every month, and staying connected to programs like ECM or maybe recovery supports, or rehabilitation programs. The goal is not just to help you get a place, it's to help you keep that place long term. Okay. Two more housing related supports are known as transitional rent and rehabilitation programs. Transitional rent provides rent payments for up to 6 months per household while you transition from being unhoused, or are in unstable housing into a more permanent place. And I have gotten this question before. So only one household can receive this community support for transitional rent. Um, but if like your roommate is the one receiving the transitional rent, that doesn't affect your ability to be authorized for other community supports or ECM. It's just that would just be an additional benefit to you. And rehabilitation programs are structured day programs where you can build independent living skills, like learning how to navigate public transit. You can also work on social skills and routines. And it also helps you connect with community resources, job opportunities, education, or recovery supports. Um, they can be this these programs can be really helpful for people who are rebuilding their lives after being homeless, incarcerated, or maybe after a long hospital stay. These trainings can be done in group settings or just one-on-one sessions, and they can be, it depends on the provider, but they can be delivered in your home, the community, or at the provider's service location. Okay. Another community support, or two more. They also include food and home safety help. So, medically tailored and medically supported meals means that you may qualify to get meals or special groceries that are designed for your health needs, whether those needs be diabetes, heart disease, maybe you're recovering from surgery and have a specific diet. So this support is only for a limited time, but it can definitely make a big difference. Um, I believe you can only receive this at first for about 2 to 3 months, but your individual managed care plan might extend this time based on your specific situation. But luckily, you can also receive nutritional education so that you can continue to make similar meals once the support ends. There are also services for home changes and asthma. So environmental accessibility adaptations, you might also see this be called home modifications. Um, this support includes things maybe like adding grab bars or ramps. If you're in a wheelchair, it can also widen doorways. It's basically just anything that will help you get around safely at your home. And the good news also for this support is that, you don't need to be a homeowner. You can be a renter. You just need to get approval from your landlord for these home modifications to take place. Another similar support is called asthma remediation. And so this includes reducing triggers in your home. So maybe like you have mold or you have pests, heavy dust, and that's causing you to have a lot of asthma attacks. Um, there's some home modifications that you can be approved for just to make your space safer for you, safer to breathe in. So yeah, the essentially the goal of these supports is to help you live more safely and comfortably at home. Okay, the next ones we have are caregiver services. So these two are called personal care and homemaker services and respite services. These are community supports that involve caregiver supports. So, personal care and homemaker services include assistance with ADLs, which are activities of daily living. That could include bathing, dressing, eating, assistance with using the bathroom, and IADLs, which are instrumental activities of daily living. And so these also include maybe like meal prep, grocery shopping, general housekeeping, maybe some money management. Um, the service essentially acts as in-home supportive services, which are also known as IHSS. And so you can get service during IHSS waiting periods if you're waiting to be authorized to receive that service or when all of your hours are used up for the year. Respite services provide short-term non-medical supervision for members when their regular caregiver is absent or, just needs relief. They need a little bit of a break. This includes in-home and facility-based respite to prevent caregiver burnout, which is definitely a real issue, and to avoid institutional placement of the member while their caregiver is away. And maybe their caregiver, is in the hospital and they need some short-term um, caregiving in the meantime. So the goal of these supports is to help support you and your caregivers when there are care gaps. Um, okay, so recovery after hospital or crisis. If you've ever been discharged from the hospital or something similar, and had nowhere to go to fully recover, these next supports might be for you. Recuperative care is also known as medical respite, and it's a short-term support that gives you a temporary place to recover after a hospital stay. If you can't heal, maybe on the street or in a shelter or anywhere else where you would be going after getting just discharged. Short-term post-hospitalization is pretty similar to recuperative care, honestly, but so it gives you temporary housing when you're medically stable, but maybe your old living situation isn't safe or it isn't available anymore. And so these two supports, since they are similar, they're actually going to be combined into one next year. And we don't quite know what that is going to look like, but the core of their benefits to members are going to stay the same. It's going to be short-term housing to recover. I do want to also note another important thing about these two services. So short-term post-hospitalization and recuperative care, as well as transitional rent, which is what we talked about previously. Um, they have a combined cap of 182 days, which is about 6 months, within one 12-month period. So say for example, you have received recuperative care for 3 months and you have found housing, and so now you'd like to use transitional rent. You can only use 3 months of that transitional rent for a combined total of that 6 months. But luckily, when you're after the first service was started, you can ask your managed care plan to be reauthorized, so you can have additional time. And sobering centers are a little bit different than the community supports we've discussed so far. This is only a 24-hour service that gives people who are intoxicated, a safe place to sober up and be connected to treatment and other resources instead of just, going to jail or the emergency room. So I would say this is the only support really that you wouldn't ask about beforehand. But if you or someone you know does end up at a sobering center, they make sure to take great care of people and connect them to good resources. So these supports are essentially about giving you the time, space, and resources that you need to recover. Okay, the next two community supports are kind of like transitional services. They're known as community or home transition services and assisted living facilities, or everyone just calls them ALF. Transition services to help individuals that have like nursing facility level of care needs transition to the community or home-like community settings. So the community support ALF, which is that assisted living facility, transition services facilitate nursing facility transitions to home-like community settings. So that might be like a residential care facility for the elderly or an adult residential facility. Um, and it might also work to prevent nursing facility admissions in the first place and just go directly to those community-like settings. So this support includes time-limited transition services, like help with your housing search, moving coordination, and it also includes ongoing assisted living services like those activities of daily living and instrumental activities of daily living that we previously discussed. And so yeah, those that might include meal prep, using the restroom, showering. And the other support is community or home transition services, which help individuals transition from an institution, like a licensed nursing facility, to the community, maybe in their own home, maybe in a different community setting like that. It includes two important parts, which are transition coordination. So that would be, again, helping with the housing search, filling out applications, assistance with the move itself, and then non-recurring setup expenses, which would cover security deposits, utility setup. Also, if you owe any utility from a different place, that can also be covered. Pest control, adaptive aids. And so some parts of these services might sound similar to other supports that we've discussed, like personal care and homemaker services, the housing transition service, housing deposits. So the goal is just to prevent basically the need for higher levels of care. And just because they are kind of the same as other services, doesn't mean that you don't also, like, you might also be eligible to receive those services on top of these, um, which is great news. Um, yeah, it would just be up to your managed care plan, so you would need to ask them about that. Another really important benefit is transportation to your care. So one benefit is called non-emergency medical transportation, or that NEMT. So this would be for people who can't safely use regular transportation because of their medical condition. So this includes transportation like maybe ambulance rides or wheelchair vans to and from covered Medi-Cal services. Your doctor or other provider will have to write you a prescription for this service and like explain why you need this level of transportation. But the other benefit is the non-medical transportation, which is that NMT. This is for people who can ride in regular vehicles or use public transit, but just don't have a way to get there. So this service can cover things like bus passes, gas cards, or ride shares to your Medi-Cal covered appointments. So NMT is great because this service doesn't require a prescription. You just need to tell your plan that you have unmet transportation needs, and they'll work to resolve your issue. And so to access this service, you would need to call your plan and say something like, I need help getting to my medically necessary appointments. Can I get access to NEMT or NMT for my upcoming visits? And then, they'll connect you with the proper resources. Um, so these services aren't new under CalAIM, but transportation is a big part of making all of the other CalAIM um, services like ECM or community supports, actually usable. Because, you can't benefit from Medi-Cal if you can't access all of the offered care. Okay, I know I've just thrown a lot of information out there. So I just want to pause and maybe do a mental checklist. So I'm just gonna run through maybe situations that you or someone you know are in, and suggest what community support might be good for that. So I just want you to think about yourself, your family, or someone you support. Is housing unstable, or are there deposits and move-in costs stopping you from getting a place? This might mean that housing transition navigation, housing deposits, and or transitional rent might be beneficial. Is it hard to keep track of appointments and medications, and you need connections to things like housing or food resources? Sounds like enhanced care management could help. Would meals designed for your health condition be helpful for a little while? You may want to ask about those medically tailored meals. Do you or a loved one need a safer home setup or to prevent asthma attacks? Home modifications or asthma remediation might be right for you. Is someone coming out of a hospital, jail, or maybe a program with nowhere safe to go? Recuperative care or short-term post-hospitalization could definitely help. Does your caregiver need a break, or do you need additional caregivers to fill in some short-term gaps? You may qualify for respite services or personal care and homemaker services. And finally, do you struggle to get to appointments because you don't have a ride? You should ask about those non-emergency medical transportation services or the non-medical transportation service. So if you said yes to any of these, I think it's definitely worth the call to your Medi-Cal plan to ask about enhanced care management, um, community supports in general, and those transportation services, the NEMT or the NMT. Okay, perfect. I think that this slide is honestly the most important one, because we're just going to go over how to ask for these services. So you can call the number on the back of your care plan card, and you can say something like, hi, my name is blank. I'm a Medi-Cal member. I heard about maybe enhanced care management and community supports, and I'd like help with, let's say, housing and medically tailored needs. Um, if you don't have your care plan ID card, you can also just search online for your care plans, like the general California member services phone number. That'll come up, and they will absolutely be able to direct you to the right department, who can get you the care that you need. And I do, or you would then want to briefly explain your situation. Maybe you're unhoused, you're leaving the hospital, you're living with serious mental illness, and you just want to ask them what services your care plan offers and how you can be evaluated to see if you qualify for any of these services. You can also ask your doctor, therapist, case manager to refer you to maybe someone else, maybe a trusted community organization like Hubbert Homes, and they can also help you make that call or fill out any forms. Okay, well, after all that, what if they say no? What if your request is denied? That doesn't always mean that the door is closed. If this happens, you can absolutely ask why you're being denied. You can ask for a written notice of the decision. You can ask how to file a grievance or appeal if you think that you do and you should qualify. You can also ask, is there another program or support that I qualify for if maybe you don't qualify for any of the CalAIM services right now? You can also bring that letter that you'll receive or information to an advocate, case manager, legal aid, or again, a community organization like Hubert Homes for help. You absolutely, have the right to ask questions and to understand all of your options for your health. Okay, so I'm just gonna go through a really simple example of maybe how these pieces could fit together. So I just want you to imagine someone who is living on the street and they're going to the emergency room a lot. The hospital then connects them to enhanced care management and recuperative care. So now they have a safe place to heal, and they have a lead care manager that is working to connect them to other helpful supports and resources. Their ECM lead care manager also maybe helps them get connected with housing transition navigation so that they can have assistance applying for units and to gather necessary documents. Their care manager also connects them with housing deposits and maybe transitional rent so that they can afford to move into this place. And then once they're housed, they could be connected with housing tenancy and sustaining services, as well as the rehabilitation program to help them stay stable, build skills, and to be connected with the community. So this is the kind of crisis to stability pathway that CalAIM is trying to create. Not everyone's journey will look exactly like this or look exactly the same at all. But this just shows how the services are meant to work together to support your whole person. Um, okay, and it's also important to remember that, Hubert Homes is here to help. They work with people who are focusing on recovery and stability. Their staff definitely understand how confusing Medi-Cal can be, and can help you think through next steps or connect you with other organizations. And while Hubert Homes can't control who gets approved, unfortunately, they can help you understand what questions to ask, how to communicate with your plan or care team, and explore housing and support options that may be available. So you can reach out to them, via right here, their listed website, Ben Hubert's email, or by calling the number shown as well. And like Ben said at the beginning, I personally work closely with Hubert Homes, and I think it's safe to say that they're an amazing organization who go above and beyond to help you and their clients however they can. So I know that you're in great hands with them. Okay. That seems like that's all I have for you today. So thank you so much for spending this time with us. And I hope that you learned at least one or two new things. So now I'm going to open it up for questions, but please feel free to also put your questions in the chat if you don't feel like unmuting yourself. And if we can't answer anything specific about your case right now, we'll do our best to give you a next step or a best place to follow up.
Thank you, Piper. So just a couple of questions that came up in the Q&A. The first one is, what type of professionals consist of the care team? Is it just social worker and the nurses, et cetera?
hmm yeah, so for ECM, you would have a clinical consultant who is kind of like overseeing the care plans that your lead care manager is developing for you. You might also, it definitely depends on the provider, but you might also have um, a peer support specialist who's there to help you. One of the core services is has to do with like family support. So some providers also have like a licensed family, I think it's like a licensed family therapist. I'm forgetting the exact name. But yeah, your care team at its core will likely be a community health worker, a lead care manager, and a clinical consultant, but it definitely depends on the provider, who else is supporting you.
All right. Next question. For Santa Clara County, we have a free managed care plan. Anthem Blue Cross, Santa Clara Family Health Plan, Kaiser. Do you have a list of ECM agencies and or community support agencies contracted with each of the three MCPs above?
I personally don't have that. I have emailed all of those care plans asking for that. Um so if I do get access to that, I can absolutely send it over to Ben who can send it out. But yeah, currently I don't have a database with that information.
Just a couple of things to add to that as well. Um, One of the good ways to get at least some of the context for people that have those supports, as Piper mentioned, is calling the managed care plans themselves, just a phone number uh, to get an idea of who offers those services. And also in Santa Clara County, there is the Service Providers Network, which is a really good place to send out an email to ask who offers those particular, and you can get on that list server pretty easily, just request it. You can send out there, hey, I'm looking for ECM services, who offers that, and you'll get a lot of responses. All right, the next question is, so clients with hoarding, will they help with cleanup and clearing out the stuff?
Um, that's definitely a good question. I'm not sure. Most of these supports are for move in items, not necessarily move out items. But that's definitely something that when you're authorized for this service, you can reach out to your managed care plan. All of the things that I listed are not comprehensive. And so it's kind of up to them to have the final say of like what services that they'll reimburse for. But I mean that definitely sounds like something that should be able to be um, included. I'm sorry, I don't have an actual answer for you.
Uh, the next question is, if you're working, can you still receive Medi-Cal?
Um, yeah. If you just like have a job, can you receive medical? Absolutely. I am personally not too familiar with the process of becoming an enrolled Medi-Cal member. Um, but I think that they just have that general California line. So you can just call them up and they'll direct you to the right department to get started on becoming enrolled.
And another thing, just kind of note about Medi-Cal is they actually are changing sort of the requirements so that you actually, in order to qualify for Medi-Cal, you either have to volunteer or work 20 hours a week. So there is some ability to work along with Medi-Cal.
Okay.
All right. So there's another question about first month's rent. I'm not going to say your name. Can you just take down my email address and then yeah, just send me an email and then I can see if I connect you with the services for housing deposit. And that's Ben at Hubbert Homes. All right. The next question. We have been trying to educate our clients on housing navigation services and deposits for a while, but don't have a lot of luck accessing it through a client's self-referral. How did other agencies coordinate with community supports? Who do we go to when Medi-Cal servicers don't respond to our request?
Um, Great question. I know some people, um, well, I'm so sorry. So the beginning of that is just like how to find other housing navigators.
Do you want to ask the question?
Hey there, can you hear me?
Yep,
Yeah.
yep.
Yeah, so I guess my question is like, we understand that there are some uh, housing related programs out there, but we're not really sure how to steer our clients to successfully get in touch with housing navigators or access the deposit program.
Okay. Um, yeah, well, just to for you first to build connections. You know, I like to do just a simple search. Sometimes AI can be a helpful tool of like, you know, like housing deposit providers in my area, housing transition, like CalAIM, housing transition navigators. And then I do like my own outreach. I email them. I say, hey, could we refer members to you? Another helpful resource. Are you familiar at all with the Path CPI meetings?
No, not me.
Okay. Um, Ben, are we able to send out like an email to all attendees?
Yeah. Yeah, I can send it.
Okay, awesome. Yeah, I just want to make a note. Past CPI meetings can be helpful for providers, you know, maybe members too, but I know they're specifically helpful for providers. That is where managed care plans are in attendance. So you might be able to get help or advice from them. It's also a great way to make connections with other community-based organizations that are CalAIM providers and might provide those services. Um, yeah, I would say that that might be my best suggestion. Is there any part of your question that I didn't quite answer?
Um, I I guess our main so we work with homelessness prevention, and we frequently refer folks over to community supports housing navigation services. And it just seems like our clients have a hard time staying in touch with their case managers, or is sometimes there's not a lot of clear direction. And I'm not really able to find too much information online when I look up other than that like deposit and navigation services
Mm.
exist, if that makes sense.
No, yeah.
There's a
Sorry, I think I cut you off.
no, I was finished, sorry.
Oh, okay, perfect. Um, yeah, I mean, and that's definitely a common struggle. Sometimes lead care managers get overwhelmed and um they're struggling to continue to do that outreach and to continue to meet um members where they are. Um, I would just maybe with the organizations that you're referring to, if you're able to schedule a quick meeting with them just to see if there's anything that you can do or anything that they need to be different in order to have that member you know, not slip through the cracks because that's I mean that's the whole purpose of what CalAIM is supposed to be. But those past CPI meetings are definitely I think a very helpful tool, and I know there is an in-person meeting in Santa Clara on May 20th from 10 to 2, I believe.
Thanks so much. I'm really looking forward to looking into the past CPI meetings and get to know more. Thank
Yeah.
you.
Yeah, I would definitely say that that's definitely a place because the MCPs are there to let them know sort of some of the challenges that you've run into in terms of getting those services. So they're all there. So definitely bring it up with them to let them know, and asking them how to better navigate a really good approach.
Appreciate you guys. This is super helpful webinar. Thank you.
Thank you.
Last question is people with a share of costs, SOC, do any of these services require share of cost, SOC?
Um, I don't believe so, and I don't want to spread misinformation. So we can absolutely look that up and maybe we can answer that later. But currently I don't think so.
Um, there's no name here, but if you reach out to me, I can follow up on that. Again, Ben at Hubbert. Any other questions folks have? Then unmute me. Like to ask any questions. All right. Well, again, thank you so much, Piper, for the presentation. Just so that everyone knows, the all the slides in this presentation will also be online. So if you go to huberthomes.com, there's a link for the webinars. So all of our previous webinars are there, slides as well. So if you, yeah, the recording and the slides will be available for this one as well. And also continue to look at that particular site. We definitely have upcoming webinars as well. You know what's coming down the pipe. Thank you again, everyone. And yeah, if any questions you guys have, feel, please feel free to reach out to me, get the questions answered.
All right. Thank you so much.